So the first question, a mechanically vented patient develops rising peak pressure. So our peak inspiratory pressure here, or our peak airway pressure here is 45. So when we do our inspiratory hold, the patient plateau pressure is 25. So that means, remember, our normal plateau pressure should be less than what? Less than 30. So that means this patient has a normal plateau pressure. So if the peak airway pressure is high and the plateau pressure is normal, then that tells me this is a what? A resistance problem. So it's an airway resistance problem. And based on that, the best answer there will be what? Bronchospasm or mucus plugging. So that will be the best answer there. I'm moving on to the next question. A patient with ARDS on ACVC, the tidal volume is 420, plateau is 30, and the PEEP is 12. So what's the driving pressure? Remember, we said that driving pressure is the difference between your plateau minus your PEEP. So that will be the driving pressure. So that will be 30 minus 12. And the answer there will be very good, 18, guys. Next question, a ventilated COPD. And don't forget, in these patients, right, you can see here that the driving pressure is high because our goal is to keep your driving pressure below what? 15 or lower than that. And so for this patient, what are the ways that we can improve this patient driving pressure? Very good. So you can either go down, you can decrease your tidal volume, that's one, right? Or two, you can try to recruit the patient by increasing your what? Your PEEP, right? Moving on to the next question, a ventilated COPD patient becomes hypotensive shortly after intubation. The ventilator waveform show expiratory flow not returning to baseline. So that's suggestive that this patient probably having what? Auto PEEP or having increased intrinsic PEEP. What's the best immediate intervention? So it's important to decrease the what? Respiratory rate, guys. And then moving on to the last question. A patient on ACVC has a tidal volume of 400 and a plateau of 28 and a PEEP of 8. What is the lung compliance? What's the lung compliance, guys? Remember, I say compliance is what? Is the change in volume divided by change in pressure. And what's our change in volume? That to be the tidal volume. And what's our change in pressure? So that to be plateau minus PEEP. So if we plot our number into this equation, so that to be 400 divided by 28 minus 8. So that to be 400 divided by 20. And that's going to be 20, guys. So the answer there is going to be, so the best answer there will be 20. So it looks like we have two answers here, guys. And then we've come to the end of today's lecture, guys. Don't forget to like, subscribe, and share this video with your friends so that we can continue to make very good video like this. And I will see you guys in the next lecture. Bye.